Launch when you want.
You're good to go.
Okay. Good afternoon. This is David Sweat. I'm Deputy Director, Shelby County Health Department, and welcome to the press briefing for the City of Memphis and Shelby County Joint COVID-19 Task Force. We have a number of things that we want to report on today and share information for you about and answer your questions if you have any questions. We have reached a milestone in the epidemic nationally, and that milestone is a grim milestone of 500,000 deaths in the United States due to COVID-19 disease. In Shelby County, we've contributed 1,460 deaths to that total, representing 1.7% of all the cases that have been diagnosed. But we do have some good news. Our active case number is down to 1,531 active cases right now, meaning there's been 1,531 cases diagnosed in the last 2 weeks. So that's a big improvement over where we have been during the surge. It actually takes us back to levels that were similar to where we were in early October of last year. As far as the total number of cases reported, 87,088 cases have been reported in Shelby County. We've had 6,871 cases reported from Tipton County, 4,631 cases reported from Fayette County in Tennessee. We've had 5,263 cases reported from Crittenden County in Arkansas, and 19,441 cases reported from DeSoto County in Mississippi. And shifting gears a little bit to information about the vaccines, we are happy to report that we had 107,015 people who have or doses of vaccine have been administered. 76,162 doses have been administered first doses have been administered in Shelby County, and 30,853 second doses have been administered, or people have received 2 doses. So that's 30,853 people have been fully vaccinated through this effort so far. When we look at some of the breakdowns of who's received these vaccines, we can say that 20% of the vaccine has gone to individuals who are between the ages of 65 and 74 years old. We also know now that 40% of all the people who are age 75 years or older have been vaccinated through this point in the campaign. And in labor statistics, we were able to figure out that the denominator, right, the pool of people who represented what we call phase 1A1 and 1A2. So this would be the first responders, the healthcare workers, the funeral and mortuary workers. From that pool of people, we can now determine that 68% or slightly more than 68% of those individuals were vaccinated in the phase 1A1 and 1A2 vaccine effort. And that's a terrific uptake. So one of the things that this is telling us is that throughout the community at this time, there's a strong desire to be vaccinated. We're aware of that. And we are sorry that last week during the winter weather, that a lot of the vaccine distribution efforts were disrupted. But we are back in business with all sites operating that are doing vaccine delivery this week. Plus, we are pushing out 40,000 doses. It's an effort this week to administer 40,000 doses of COVID vaccine here in Shelby County. So it's a massive effort this week to get people vaccinated and to catch up because of the missed opportunities due to the winter weather. And as far as other information, you've likely heard by now that there was a South African strain variant discovered over the weekend, or found through surveillance efforts over the weekend. And we've been conducting investigations around that case since Friday. What we can say right now is that we believe that is travel associated, in the sense that a person who had traveled out west in Colorado and Washington State and then came into Shelby County and visited with some local residents is the source case. So the family was exposed to that individual with a travel history out west, and that there is no evidence right now that that South African strain is transmitting in our communities anywhere in the county, although we continue to investigate that case to make sure that that is the case. But right now, there's no evidence of local transmission, and that's good news. And it's also good news that we detected this, because many communities in Tennessee and around the country don't really have the ability to find these strain variants. But our local laboratories and the UT Health Science Center have set up a robust local effort to find these strain variants. And so on the one hand, it may sound scary when people hear that we have found a strain variant. And so far, of course, we have found one that was from the United Kingdom strain. We found one that represented a strain out of Brazil. We found one now that represented a strain from South Africa. But we have tested, we have performed more than 1 million tests in Shelby County during this pandemic. 9.9% of those tests have turned up positive. And ever since we started looking for strain variants, so far, we've only found 3. So the vast majority of people in Shelby County have been infected with normal COVID-19, or what we call wild type COVID-19. And our local surveillance effort with the laboratories and with UT seems to be very robust and capable of detecting strains so that we can rapidly respond to those with investigations and make sure that folks, if there is any evidence of transmission going on, that we have the opportunity to make sure people get in isolation and quarantine to break that transmission. We will also point out that the other good news in the epidemic right now is that we have been below 1 for our reproductive rate for the virus ever since the beginning of January. So throughout 2021, so far, we have been shrinking the epidemic. And so we first went below 1 right around January 1st, January 2nd. We are now at a reproductive rate of the virus of 0.74. That is the lowest rate we've ever documented. And that means that each case is creating 0.74 new cases. So we've been able to sustain that. We've been able to hold that very low level of transmission, or shrinking the future epidemic. And right now we would be looking at somewhere between 1,500 and 1,600 cases in the next 30 days by the end of March, if all these conditions hold at their present status. Continue to see the number of people hospitalized to drop. We had 220 people in the hospital last night, and continue to see improvement on that metric as well. So in many different ways, the situation is improving with the COVID epidemic, and the vaccine effort will only help us further prevent the transmission and to sustain the shrinkage of the future pandemic and give us a pathway out of this. So this is all good news, even though there is, of course, some difficulty observed along the way, as you know. I mean, we have had 1.7% of our people have died, and there is a news report that you're all aware of, I'm sure you have questions about, that there were 1,315 doses of vaccine that did not get administered, that had been thought out. And the director is not with us today because she and state officials are conferring. And the only thing I can tell you about that right now is that the state of Tennessee Department of Health should have a statement sometime later today about that situation and what they're looking into there. So I don't really have any other information at this time. But if you have other questions, I'll be happy to answer them for you right now.
Thanks, David. And for those that are joining us from the media. If you would, to ask your question, just use the raise your hand feature, and I will call your name and give you the ability to unmute. But please, at that point, also reintroduce yourself and what outlet you are representing, as I don't have the outlet names in front of me. I know most of you and your outlets, but just want to make sure we get it right. First off, we have Brad Broders.
Thanks, David. Good to see you again. Brad Broders, Local 24 News. Speaking on the, I know you were talking about the 40,000 doses this week. I know there's been a lot of rescheduling. To the public kind of concerned out there about getting their appointment within that 6 weeks time frame, if you could just talk about the doses this week and your hopes about people who need that dose within 6 weeks being able to get an appointment.
Right. So thank you, Brad, for the question. And we know that there's a lot of concern and anxiety on the part of individuals who've had their first dose and they're trying to get that second dose. What we also know is that we're getting more and more data from around the world every day that shows the first dose is very effective and has a prolonged effectiveness. So although the vaccines were developed in rapid fashion, and they only, the recommendations for the emergency use authorization reflect that, saying that you get that second dose within 3 or 4 weeks, depending on whether you had Pfizer or the Moderna vaccine. They also tell us that it's okay for people to be vaccinated with that second dose out to as many as 42 days after they received their first dose in the case of the Moderna. And we're continuing to get new evidence every day that if you don't get that second dose exactly in the 21 to 28 day time frame, that the first dose is still very effective for a longer period of time than it was initially tested for. So they also tell us that if you miss that second dose, once you get that second dose, you're fully vaccinated, even if it's been more than 28 days in the case of Moderna. So there is no effort to restart the immunization, right? So you don't restart your series if you miss it. So all indications are that you want to get that second dose as fast as you can within the window, but if it's a little bit later, it's not going to be ineffective. The first dose is still very effective for longer than the 42 days or whatever. But the effort is definitely to get vaccinated as soon as you can, but it doesn't lose its effectiveness if you don't get it exactly on the 28th day, for instance. So, but we do have a number of sites that are operating. We are pushing out extra vaccine, trying to get that 40,000 doses administered this week. It was a big effort in a single week. And we're grateful that we have other partners in the community that are also involved in the vaccination efforts. So Walmart pharmacies, for instance, and for those who are veterans, the VA hospital has been able to restart their vaccine campaign as well now that the winter weather is over. So we have a lot of different ways for people to get those vaccines, and we're definitely excited that later this week or next week we'll be opening up to additional parties like the schools. So a lot of progress going on right now in the vaccine front.
Thank you. And next up we have Catherine Burgess.
Hi, Catherine Burgess with the Commercial Appeal. I'm wondering, regarding the doses that expired, can you tell me when they expired and when the health department was notified by the pharmacist of their expiration? And then also if that happened specifically because of the decreased number of vaccinations due to the severe weather, or if there were other factors that led to the expiration of the doses?
Yeah, unfortunately, I'm actually not privy to any of those details right now. Dr. Judy Martin is the head of the vaccine campaign. Dr. Haushalter, obviously the director, is very intimately involved in looking into all these factors. But I'm over the COVID response unit. We work on testing, investigating cases other things like that. I don't really have the details that you're asking about, but as I said earlier, that the Health Department, the Tennessee Department of Health, the CDC, they're all collaborating on examining these factors, and I expect that they have some sort of an availability later today to answer those questions for you.
Sure. Can you tell me if any other doses had expired or had to be discarded before this 1,300?
I have no information that there were. I don't know of any. But
okay, if I can squeeze in an unrelated question then.
Sure.
Can you tell me, are the vaccination sites in any jeopardy of closing because of water pressure issues, or are they unaffected?
Right. I've not heard that water pressure is going to interfere with the sites delivering the vaccines. Most of those are outdoor sites. Mm-hmm. And for instance, like with the toilet situation, those are porta potties. So they're not as directly affected by a drop in water pressure. And I, along with everybody else in the community, of course, look forward to hearing from MLGW on how things are going with raising the water pressure and at what point we'll be able to lift the boil water advisory. I have no information about that, but I've certainly not heard anything about a drop in water pressure jeopardizing any of the vaccine sites.
Thank you.
Thanks. Next we have Kelly Roberts.
Hey there. Yes, it's Kelly Roberts with Channel 5. Going on the 40,000 doses that y'all would like to administer this week, what does that say about the vaccines that you have on hand and the allocations that you all are receiving this week? Is it a mixture of thousands of vaccines that were left over because of postponements and new shipments coming in? Do we have 40,000 vaccines, ready to be pushed out? And should people expect, how about the logistics of just, handling all those people at all those sites? Should people expect the long lines? Are you increasing staff?
Right. So thank you for that variety of questions, Kelly. I appreciate that. The vaccine that we're pushing out is vaccine that we had on hand at the beginning of the week. So that includes doses that we could not deliver last week because they were, the sites were shut down because of the weather. It includes the doses that were planned for this week. And it also includes any other doses that had been, not used or still in inventory from previous shipments. And we are getting multiple shipments a week. We got two different kinds of vaccine. We got Moderna and Pfizer, and we've got vaccine doses that are being delivered to be first doses for folks who are brand new to be vaccinated. But we're also getting the second doses delivered for people who have been previously vaccinated. So now that we're up to 76,000 people, 76,162 people have had a first dose. So that means we've got to continue to get new first doses for the rest of us in the community, but we also have to bring in now 76,000 second doses for the people who've gotten their first dose, right? So the numbers of doses being delivered have to continue to grow in order for us to continue to grow the outreach of the vaccine campaign and keep up with folks who need the second dose, right? So the good news is that the Health and Human Services, the White House, the CDC, the state of Tennessee, that more vaccine is flowing. That when we started this in December, we had a very, very small amount of vaccine moving, and that all of that inventory is increasing every day as more and more vaccine gets manufactured and purchased and distributed into the system. But it has to, because if we don't, we won't be able to continue to grow in the vaccine campaign. So we're grateful that right now 11.4% of the people that we want to vaccinate to meet our local target have been vaccinated. And but 76,000 of those people have had one dose. So we've still got to catch them up with their second dose as we enroll new people. So I don't know if that answers your question, but there's a lot of logistics going on. I think that's the simplest answer is there's an awful lot of logistics going on behind the scenes to move all this vaccine around the country.
Thanks. Next up, we have Jackie Massey.
Hi, it's Jackie Massey with Fox 13. Want to ask you a little bit about the VaxQ system and how often you guys are using it. And I'm asking this because I've been hearing from viewers that they're getting access to the vaccine due to word of mouth. Like they might know a friend that's a doctor that's saying, hey, there's all these available vaccines. What about those people on the VaxQ list? Like it seems like those people might not get the heads up as quick as these people who are hearing word of mouth. Like how many people are actually using this system? And I have a follow-up question.
Sure. Okay. So in terms of the VaxQ system details, I don't actually know how many people have registered through VaxQ. I do know that it does get utilized. And so particularly as either people miss appointments, don't show up for an appointment that they were scheduled for, or they realize that they've got some vaccine available, that they send out alerts. Now with the VaxQ system, people indicate a time frame. In other words, like if you send me a notice, I can be there within an hour, or if you send me notice, I can be there within 2 hours or whatever. And so as they know that they've got an appointment available, and they look at that time frame, and then how soon do I need somebody to show up, and they push that alert to people who are able to avail themselves of that slot. But in terms of how many people have done that, I don't know. I have heard of it being done, and I don't know if Mr. Dakin has information. I know that was an effort that came out of the mayor's office to some degree as well. But the rest, I don't know, remind me, Jacqueline, of the rest of your question. There was a lot there.
Yeah. I've been hearing from our viewers that they have been hearing through word of mouth about extra vaccine being available, and they're just going to these sites getting the vaccine. And I'm just wondering, how's that fair for people who are on the VaxQ list if there's other people hearing through word of mouth? And are you aware of this happening? Because I know I've been hearing and been contacted about this happening.
Right. Yeah. I haven't. I mean, I don't get those rumors to the same degree. You may be more in a position to hear those rumors than us. But there's a lot of sites involved, right? And so some of those sites are operated by us, the Shelby County Health Department. Some are operated by the city in partnership with us. Some are operated with other venues. And then we have the healthcare systems, so they have their own efforts, vaccine delivered to the hospitals and the healthcare systems, as well as the pharmacy, which gets their shipments separate from us altogether. And we have no interface with them. We don't really know about their scheduling and things like that. So I can't really speak to, I mean, if you're getting those reports, I wouldn't say that it's untrue, right? If you're getting those reports, that may be happening. That's certainly not the design. That's not the intent. But there are a lot of different sites and a lot of different partners involved in the vaccine efforts. So I don't know exactly which site, which partner, who's running that, where is that occurring. But when we are using our sites, the Shelby County Health Department sites that we're administering, my understanding is that when they have open appointments, they try to use the VaxQ system to get those slots filled.
Okay. And if I can ask something else, in terms, I know you're not really talking about what happened to the vaccines that went missing, or we ran out of the vaccines, not ran out, but discarded them. What efforts are you guys making to make sure something like that doesn't happen again? Can you speak to that?
Well, all I can say is that that's what the director and Dr. Martin and the state and CDC, they're looking at all those best practices and things that we can put in place to make sure that this doesn't happen again, because obviously this is serious and we don't want this to happen. But that's something that would most probably be addressed in the later press availability today by the state.
Thank you. And it looks like we'll have time for one more question. I'm going to turn it over to Jacob Steimer.
Yeah. Again, I know you don't know, or you're not going to speak about the specifics, but between the discarding and the communications about the restaurant on Friday, the health department has been roundly criticized in recent days. I'm wondering if you're aware of any discussions of personnel change.
No, I've not been involved in any discussions of personnel change. Thank you for the question. I mean, I'll be honest with you. We've been criticized for a year about one thing or another, right? And we understand that the community gets frustrated with us over one issue or another. But what I can assure you is that everyone in the health department, everyone in the mayor's administration is working really hard to do the best that we can do for our citizens. And that the criticism comes with it. You know, feedback of all kinds comes with that. We understand that. But our effort is squarely to try to meet the needs of the community and to get the vaccine out, to protect the community in all the different ways that we can, to slow the spread of the virus, to preserve life. You know, that's our mission, that's our vision, that's our values of what we're trying to do. And but we understand we're imperfect. We don't get it right 100% of the time, every time. But the effort is genuinely, and the intent is genuinely to do the best we can every day.
How surprised are you at how good the numbers have been recently on cases?
I have to be very honest with you. I'm very happy with that and a little bit surprised. And we have, I mean, yesterday I was in conversation with a couple of state epidemiologists and we were discussing this, so looking across the Southeast. And when we look at the numbers in the Mid-South, right here and locally, and our case rates per 100,000 are now about 11. And every county in the Mid-South is also seeing improvements. And right now, the lowest case rates are over in Crittenden County in eastern Arkansas. So the numbers are coming down a lot faster than we really expected them to. And we do take a little bit of a grain of salt with this right now, because the recent numbers are probably artificially depressed by the winter storm. And that did reduce the number of people going out to be tested and diagnosed, which lowers your case numbers, right? So we're not going to be surprised at all if this week there's a bounce back. As the testing sites are back fully operational, we may see an increase this week in numbers. But in general, very pleased that the numbers are improving. In general, the community is benefiting from that, because with Health Directive 18, as you saw, we were able to loosen some more restrictions on things like our retail restaurant businesses. Then, unfortunately, we got blindsided or hit hard by the water pressure problem. And so then a lot of places can't operate, but it's not because of COVID restrictions, it's because the water pressure is too low. So, you know, we're continuing to address that, or at least MLGW is continuing to address that. But as far as progress, we're grateful for the progress, and we're not out of the woods yet by any means, but we are getting closer and closer every day to seeing a light at the end of the tunnel. And we welcome that light.
Thank you, Mr. Sweat. And I think that was quite the closing statement, but do you have any additional closing remarks before we wrap this?
No, just thank you. Thank you for your interest. Thank you for staying with us through the year, because it's been a lot of press conferences, a lot of press briefings. We talked about a lot of different things. We've weathered a lot of storms together, and we will continue to confront challenges together. But we appreciate your continued commitment to report on this really important issue. It's the biggest public health event of our lifetimes. So thank you for being here.
Absolutely, and thank you for taking the time, Mr. Sweat, and for the media that are on the call. We are hopefully going to be back at the library for the regular press briefings Thursday, pending the water pressure issues. But again, thank you for joining, and I hope you all have a good rest of your afternoon.